time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. We game cool, make them look like cool. Always play cool, that's the biggest rule. Forget what they doing, keep on doing. Since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, XL, and Hoover, way too fireable. When this joint drop, that is called the truth. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go.
Good morning, good afternoon, good evening, wherever you're watching, and welcome. And I'm sure I sincerely mean that. Welcome to another episode of Kidney Hub East Africa. I am half your host, Steve the Kidney Nurse. Welcome. I hope everyone's doing well on this Sunday evening or morning or afternoon, again, wherever you're watching from. Today, we have a great show that applies to many people on dialysis. Wherever you go get treatment, whether it's in East Africa, the UK, Canada, Asia, United States, wherever, you have patients' rights and responsibilities. So here with me again today, as always, is our brother from Kissimmee, Kenya, right outside of Nairobi, our brother Moses Kennedy. Let's give him the special guest welcome. Let me get to that video. Here we go. Brother Moses, welcome.
Thank you so much, everybody.
How you doing?
I'm good.
Good, good. And I want to thank Camille Pantuso. Thank you for coming by and comment. I appreciate you joining the show, as well as everyone else that's watching. So, Brother Moses, how's everything going today with you? When was your last treatment?
On Friday. But I've remained exhausted to date, Sunday. So, but we must stay put. as warriors.
Mm-hmm.
Yeah, I've been unable to walk, very tired from Friday.
Did you put off a lot of fluid on Friday?
I know I just did 1.2, but I normally do 2.
How
Yeah,
many hours you run? 4 hours, right?
yeah, 4 hours.
Mm-hmm.
Yeah,
Wow.
but
Well,
I'm managing it
when do you go back?
on Tuesday,
So you go to treatment on Tuesdays and Fridays.
Tuesday and Friday.
Is that everyone at your clinic, or they got different days?
Different days. There is Monday and Thursday, then Tuesday and Friday, then Wednesday and Saturday.
Wow.
Yeah,
I didn't know that.
yeah.
I didn't know
There are
that.
so many are
I mean,
suffering from
that's some
this.
different options opposed to here in the United States, either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. However, you have some people that the doctor may schedule twice a week, maybe Monday and Friday, because they may still have kidney function, or Tuesday and Saturday. It's not unheard of, but okay.
Yeah.
So you chose the Monday and Friday.
Yeah, so at least you are able to have 2 days in a week.
Mm-hmm. Mm-hmm.
Yeah.
So, Brother Moses, let's talk about what we're here to talk about, and that's patients' rights and responsibilities. In fact, you came up with that topic. Why is that topic so important to you?
Basically, this is where a better outcome lies from. You remember, patient's right and responsibility forms the basis of assisting and identifying the most vulnerable in the clinic. Say maybe those who've got language barrier, or those who are illiterate. I mean, and those who are also just afraid of raising their voice for fear of being victimized. So really, this has been informing. This has always laid a basis ground for me to think about this topic, because something as simple as scheduling will affect a patient if he is not involved in scheduling of treatment plans. Yes.
Okay. Well, I did some research about patients' rights and responsibilities in East Africa. And this is what they say. Dialysis patients in East Africa are covered by the same basic rights that apply to all healthcare users: informed consent, confidentiality, safe care, non-discrimination, access to information, and complaint mechanisms. Now, do you see a lapse at your clinic or in Kenya of any of these basic rights? Do you see a lapse in informed consent, meaning letting the person know what they're about to undertake and what can happen during your treatment? Or do you have, or have you seen anybody who want to get access to their medical records or anything, any problems with that, or confidentiality, patients' information being shared with other people, or safe care, meaning do you have or seen any issues with the care that you're receiving at the facility, or any type of discrimination? Have you seen any of that in Kenya in your years of going to different dialysis facilities?
Yes, having been to different facilities, I've experienced this, whereby they only emphasize on the law that really puts them safe on their side as dialysis units. But then when it comes to the other part of the patient, it is not highly regarded. For example, if you come in as a new patient, you are required to sign a consent form after you've been informed of the possible consequences of treatment and benefits. However, you are only made, in most cases, you are only made to sign in, so that it comes when it comes a time where the authorities are demanding where there is legal documentation, then they are able to prove. Yet, on the patient side, he is left and completely uninformed. So yes, it
Okay.
does happen.
Okay, because they speak of the legal and policy context that you have national patient charters, health acts, or ministry policies in many East African countries enshrine general patients' rights, policy, informed consent, non-discrimination, and safe care. They say the exact wording and enforcement vary by country and facility. So do you see the facilities that you have attended adhere to the patient charters or health acts or ministry policies that are set by the Kenyan government?
Well, let me explain a bit part of it. Yes, and sometimes no, because most facilities, they only adhere to what really matters before the authorities. But what doesn't matter to a patient is of less importance. I want to give an example whereby a patient do not know even the type of treatment they are going through. To them, it is a matter of a routine. Coming, sitting for 4 hours, then move out, then the next client. So it is very important that they adhere to that part that benefits the patient as well.
Okay. Okay.
Yeah.
So, Brother Moses, I'm going to go through 10 dialysis specific patients' rights. And I want you to tell me as a patient, excuse Excuse me, Brother Moses.
Yes.
Someone had said something to me, but I want you to tell me if you experienced and talk on this for 1 second. The first one, right to information, clear explanation of dialysis options, hemodialysis, peritoneal, conservative care risk, costs, and likely outcomes. Can you share with us if when you first started, did you have access to that information, to the right information and clear explanation of dialysis options?
Well, not really in my case, because remember, I've been suffering for a long time, and in most cases, whenever I visited the hospital, I was misdiagnosed. Now, it kept on that in that system to the extent that when my health really deteriorated, I crashed into dialysis treatment, and that is how my life was saved. So much was never explained to me, because at that particular time, uh, I guess it was just about saving my life, and that is how it was applicable to me. Um, then I kept on taking treatment for a while, and then I recovered on. And after recovery, then I became self-independent, meaning I will walk to facility, get treatment, go home, without no one telling me the time is now to go for treatment. No one is telling me today is your day. Nothing like that. So basically, that is how my experience was.
Okay.
So I was never told anything. And that is perhaps one of the contributions that made me to be an advocate, because I've been yearning to know so many things that goes about renal industry. Yeah.
Okay. So I'm gonna go through these rights. No, 2, right to informed consent. So these are the specific patients' rights that patients in Kenya and East Africa have. They are common elements that one should expect if they start dialysis in East Africa. We said the first one, right to information, clear explanation of dialysis options, whether it's HD, PD, conservative care. Conservative care is no dialysis at all. Okay. The risk, cost, and the likely outcome. Everyone has that right. Even here in the United States, you have that right to information. 2, right to informed consent. Procedures, access placement, and changes in treatment require consent. So if you got to get an access place, whether it's a catheter or a graft or AV fistula, you got to get informed consent. Just like if you start hemodialysis, informed consent. We're telling you about the procedure, the risks that are involved, and the potential outcomes. And patient signs it. Number 3, patients have right to safe access care. Expect proper insertion, aseptic technique, exit site care, and infection prevention. Now that's over in Kenya. They're saying right to safe access care, meaning if you got a catheter or fistula or graft, they say you can expect proper insertion when they put this in, aseptic technique, meaning a clean technique when they put it in there, and then exit site care and infection prevention. They say you have that right to it. You have a right, number 4, a right to continuity and timely treatment, advance notice of cancellations, and help with transfers and referrals. Number 5, right to privacy and dignity during dialysis, respect for modesty, same gender staff if requested where possible. Now that's a new one to me over in East Africa. The right, the where you the person want the same gender staff to work on, like it's like somebody here in the United States come in and say, I want that guy to work on me. I don't want this woman. And they're not going to go for that. Not unless, I mean, it's said it that way. Now, if it's something different, like they had issues, somebody sticking them, and say, I don't feel comfortable. I want this person to stick me. But to say I want this person to stick me because he's a man or a lady, I don't know if they're going to go for that. Number 6, right to pain and symptom management during dialysis. Number 7, right to transparent billing and financial information and information on subsidies, assistance options. And number 7, I want to ask you about that because, you know, you told me there's a lot of corruption in Kenya. And so right here, like the right to transparent billing and financial information, you know, how accurate would that be? Number 8, right to complain and receive a timely documented response without fear of retaliation. Number 9, right to involvement in care decisions and advanced care planning, including palliative options. 10, rights to have a caregiver family present as feasible. So do any of these rights resonate with you that I went through?
Yes, absolutely. They are there. But in most cases, they are not affected. They are not effectively supervised. So yes, they are there, well articulated in the Constitution and within the Ministry of Health's charter. But then it is, in most cases, they are overlooked. Yeah.
Really?
They are only applicable when there is a problem or something is so serious or some sort of crisis or legal tussle. That is when they will refer to it. But in most cases, yes, it is as good as in black and white.
Yes, we got a question from Jessica. Thanks for stopping by, Jessica. Yeah, we're talking about patients' rights and responsibilities in East Africa. Some of them are general, but I do have rights, patients' rights and responsibilities for people in the United States right here that I'm going to go over as well. And it's a lot. It's like 31. But they're a lot more different than the ones here that we're talking about in East Africa that applies there. And this is probably just a brief. It's only 10. You know, they may have more than 10 rights. But the one I wanted to talk, sorry about that. The one I wanted to bring back to you is number 7, rights to transparent billing and financial information. Do you see corruption in that part as well?
In fact, that one falls amongst number 1, 2, 3. If I will give it 1 out of 10, sometimes how the billing is done, especially if you are admitted, it becomes in a manner that you hardly would understand. Yes.
Really? Oh, we had somebody comment, when a patient has a stroke, then a month later had 2 TIAs each time their blood pressure dropped. All right, brother. Another one, number 6, right to pain and symptom management during dialysis. Do you have issues getting access to pain management at the clinic?
Yes. Yes. And because I guess some of our staff at different facilities are really not well prepared to, in fact, to your surprise, I want to tell you, even most of the technicians we have, especially this one happens especially in private facilities, they might not be aware of the bill of right and responsibility of a patient. And so, even before making you comfortable on that bed as a nurse or as a technician, one does not care your comfort. What he cares is to put you on and to proceed to the next patient. So, as you know, making a patient comfortable is part of managing pain. So yes, just like I've mentioned earlier, things doesn't happen the way it is written or the way it is stipulated. Yes.
All right, how about number 5? That stood out to me as well. Right to privacy and dignity during dialysis, respect for modesty, same gender staff if requested where possible. Have you seen anyone's dignity been invaded?
Yes, I've seen it, and many a times. What makes it even more complex is that the patient the patient is not aware that he has that kind of right, and therefore, if you even share with the patient that it need to be this way, it's like they see they are begging for a favor, you know, and now it is not even easy to to sensitize that kind of a person. It does happen, yes, quite often.
Okay. Now let's look at 8. That's all I was able to get, but 8 dialysis specific patients' responsibilities. And you tell me if you think if they can in reality be met by the average Kenyan that's undergoing dialysis. So I'm gonna go through all 8. Number 1, patients responsible to attend scheduled sessions or notify the unit in good time if unable to attend. Number 2, follow agreed dietary and fluid plans and take prescribed medications. Number 3, protect vascular or PD access. Avoid blood draws, IVs on the fistula arm, keep exit site clean, report redness, leakage immediately. Number 4, provide accurate medical and medication history, including traditional medicines. Number 5, cooperate with infection prevention measures, hand hygiene, dressing rules. 6, participate in training or ensure a caregiver is trained for PD exchanges if on PD. 7, meet agreed financial arrangements or inform the unit early about inability to pay so alternatives can be explored. 8, raise concerns early with staff using the facility's complaint procedure. What do you got to say about these patients' responsibilities? Are you think
Well,
they're real? Some of these are realistic?
sorry?
I say, do you think many of these are realistic for the average Kenyan?
No, not realistic. Not realistic
Like
in the
number
sense.
7. I'm sorry. Go ahead.
Okay.
Go ahead.
Not realistic in a way that as those bill of rights and responsibilities are put, but then in most cases there is either way gaps from the patient side or the caregiver team. Remember, there are so many shortcomings in providing quality treatment in most East African countries, and more so here in Kenya. So these shortcomings also sometimes contributes to. However, few improvements can be made if both parties are aware of this Bill of Rights and Responsibilities. And now that is the way forward. And I guess that is why even this broadcast is very important and critical.
So when you started dialysis, did they give you a patient's rights and responsibility paper?
Yes.
Okay. Okay.
Yes. I
Now,
was just given to sign, but not given time to read and to comprehend.
okay, got you.
Yeah, and that was done on my behalf by somebody else, because you remember I've always said I crashed into dialysis treatment.
Okay, so let me ask you this. Number 1 says the patient's responsible to attend scheduled sessions or notify the unit in good time if unable to attend. Now, do most Kenyans have phones where they can call the unit and say if they're not coming to treatment?
Yes, yes, there are phones, and that is a requirement that they should be calling, confirming, and confirming their appointment, so that if somebody is unable to attend for any other reason, maybe natural calamities or financial, then you are allowed to alert the facility. However, such facilities are very few. Most of the facilities do not practice that. It is just on standing order that if you are attending on Tuesday or on Monday or on Wednesday, that is it. You miss it, you get trouble in reschedule. But some are doing what is needed as far as booking and appointments are done. Yeah.
Okay, so look, number 2, patients are responsible to follow agreed dietary and fluid plans and take prescribed medicines. Now, you have mentioned that a lot of medicines are paid for out of pocket. And when it comes to the dietary measures, if many Kenyans don't have the necessary funds to get food that's required, how do you know if you can't see the dietitian? How do you know what foods are required? Because you told me that if the person
You
got to
just,
see a dietitian, that they got to pay
well,
extra.
if you can't know the food that you require, then because it involves paying, it involves adhering, and lastly, all availability of that nutritionist. Now, if you can't get both, then you rely on the scanty information that you get from maybe a health provider. Uh, uh, for example, uh, I hear it quite often about don't eat this, don't eat this. So it even makes a renal diet so complex to the extent that one, a patient can end up being malnourished, or two, one can indulge or lose appetite because of the same type of food that you are required. For example, in Kenya, one will be told that you only take cabbage, white rice, then they list food for those units that has some talking chart. Maybe they say vegetables, eggplant, onions, carrots, then protein, no organ meat, in that order. So sometimes even that display on the chart becomes more complex to a patient. And one will be wondering, now, what am I supposed to eat? You see, because um, here in Kenya, we have most available and affordable fruits are tropical fruits, which you realize that are not recommended to renal patient. So you are told you get apple. Then apple in Kenya and Africa, it is being imported, if not South Africa, then from Egypt. So that is where apple comes from. It becomes very difficult. It becomes very difficult, yeah, for one to achieve that kind of responsibility. And then when it comes to finances, you miss today, and the next treatment you also miss because you lack transport, and nobody cares. So when you miss, it is that way. It is gone that way. Yeah. And then when it comes to medication, um, mm, they want you to do an X-ray or some form of imaging, and then uh, it is an outpatient services, definitely. Then you have to pay. You have to pay out of your pocket. You have to pay medications. You have to pay. And if you can't afford, then that is it. You just wait and struggle to get transport to take you back next week for available sessions. So yes, that is how it goes on here. Yeah.
Um, let's look at number 8. Raise concerns early with staff using the facility's complaint procedure. So if at your unit, if you had a complaint, well, I don't want to say your unit, but units that you've been to or had treatment at, if one has a complaint, is it, and if you complain, is it addressed or is it looked over?
In fact, what I've realized, most units have been, the complaint mechanism is something that is wanting. It is really missing out, because sometimes you are given a survey which the feedback is not clearly given, maybe in writing, or the finding of that survey. And I've seen only one single hospital that got some nice system in place, that if you have a complaint, you have to raise it to the nurse in charge. And if the nurse in charge doesn't take any action, then you can do the writing. I've done this severally, and it has helped me. Then you can write and attach. So thereafter, it can be escalated in that manner. But very few facilities. Yeah, most facilities, the system is failing. Yeah.
Let me address this comment. Yeah, I'm listening, Danielle, baby. I'm just letting this man share his thoughts and not interrupt him. Absolutely. So I just wanted to address that comment, because I'm sitting up here considering what I'm going to say once he's finished. And she's going to ask me, do I have any comments? Of course I do. I'm going to let the man finish his sentence. Continue, Brother Moses.
Yes. So that is where the mechanism to receive complaints is not well in place in most units. However, for somebody who is informed, you can always demand, even if it means they want to involuntarily discharge you from that facility. Yeah, right. You can always demand. I've seen those who demand strongly, and now there is a little bit fear that if something goes wrong, then so and so might demand it fearlessly. So, and that is why that is why Brother Steve and I really encouraged, we encourage self-advocacy and advocacy for others.
Hey, Brother Moses, I was waiting for you to finish until I saw this comment, but what I was going to say is, and you may have seen some of these tips in Kenya, but give you some practical implementation tips for facility and patients groups. Now, you may have seen some of this or may not, but it may help you advocate, more about patients' Bill of Rights. One, display a one-page locally translated dialysis Bill of Rights and Responsibility in the unit and include in new patient packets. Have you seen that?
Well, no. It only appears on the wall as a charter, maybe where a hospital facility or company stipulates it as maybe, let's say, an SOP of that particular unit, that every unit they have to be displayed. But most patient, because of ignorant, lack of interest, state of hopelessness, this also contributes. Even if it is displayed, then it will not be of any remarkable use and benefit to the patient.
Okay. Also, what about possible explain these rights verbally at first dialysis and document that the patient caregiver received the information? So when you first, I know when you said you first started, they just had somebody else sign the paper for you because you crashed into dialysis. But on the average, when someone new starts at the unit, do they like go over the patient's rights, like say each one to them, or they just give them the paper and expect them to read it?
They give him a paper and expect to sign. So they don't sensitize, as one of the responsibility, because I think next time we'll also talk about the responsibility of an nurse or caregiver, because as much as I know, the care team must also help in educating and advocacy.
I agree.
So, yes, so they should be telling the patient that, hey, look, read this, understand, ask where you have any question, then sign. But the common place is you are given the document with the last page and you are told, sign here, then you sign.
Mm.
And that is end of business.
So when someone first starts, who normally um, intakes them? Is it the nurse, the manager, a secretary? Like when they first start dialysis at the unit for the very first time and have to sign the paperwork, is it the nurse that's making that introduction to the patient?
Yes, you know, uh, what happens? There is still a lot of diagnosis. Um, and most people who end up being diagnosed uh, has traveled the journey to the extent that they have reached a nephrologist or a physician who puts them on the program. And now, from there, he prepares everything and hand over to the nurse. So, to the unit, uh, you are booked. They check on your insurance, and then, given the instruction from the physician, uh, the nurse now runs everything. Yeah, the nurse now runs everything, and he has no time to explain to you anything. He believes that he knows it all. So his work or her work is to ensure that you just go through a process of 4 hours dialysis treatment.
Mm.
Yeah. So casually that way.
So let me ask you this. Do you think they would actually train the staff to recognize and support vulnerable patients like low literacy, language barriers, and children?
They can't afford to train. If the staff themselves um, um,
Oh, that's a good
are
point.
not well competent, because one runs through a program in the name of training, through apprenticeship, and he goes somewhere, he gets a job, and is underpaid. And because the private facility, there is a big gap that the private facility is filling because of crisis in the Ministry of Health. So there is a gap that basically the private sector has filled. So one get in and he just does the job casually, the way he thinks, without caring anything, including hand hygiene, which I've always confronted whenever I've gone.
Okay. Now, I can definitely appreciate this question right here from Daniela. I hope I pronounced your name right. But Daniela asks, can you get copies, or can one get copies of the documents that you signed when you first start, so you could take home to read, to in-depth reading for later?
I think it can't be practical, but for few of us like myself, I can demand it, Daniela, and get it. However, that one implies that in general, in average, it is not accessible. Yeah.
Mm. And that's all, even here in the States, when someone comes to dialysis, right, for the first day, there's a thick paperwork, about that much papers. It's called the admission packet. And it takes at least about, if you actually really sat down and went through it with the patient, at least about an hour. And now most units, the nurses just have them, can you sign here and we make a copy? Or they ask the person to come in early, like an hour early before their treatment time. Because their treatment time at 4, they ask them, can you come in at 3 o'clock to go over this and sign and be explained? Because it's a lot of information. A lot. And here is a lot different. I know that in Kenya, because in this consent pack, in the admission packets here, they want to give you pneumonia shot, do TB testing, ask you if you want Hep B, hepatitis shot. What else is in there? Assignment of benefits, as far as the insurance, HIPAA. Some of them have like advanced directive, what you would want done if something was to happen to you on dialysis. So many papers you got to go through, and then you got the patient's rights and responsibility and facility rules. See, I don't know, in Kenya, do they allow patients to film inside the facility? Like if you got your cell phone and you at the clinic, are you able to like film other patients and show the clinic?
Oh, not really. Sorry, we just have a blackout, but I'll just continue.
Y'all had you got a blackout?
Yes, just there is a blackout now.
Oh,
Let me have some light, a little bit light here. Let me get it in 2 minutes.
Sure. So while Brother Moses is doing that, here in the United States, again, the units where I've been charged and seen, we try to get the person to come in early to go over the paperwork. But if they come in, say, at 4, and the treatment time is at 4, Brother Moses, can you hear me?
Yes, I can hear you.
So
Just
we had
experiencing some blackout.
so we had another good question from Daniela. Keep coming with those type of questions. I'm just
Do
scared with you.
blackouts happen
Gabby,
while patients are on treatment? Aye, good question, Daniela. Yes, they do happen. We have a lot of power surges in most part of Kenya. And in fact, to be precise, Kenya does not generate enough needed kilowatts that can power the whole country. However, besides that, there are also technical problems related to power lines. You remember in Kenya is one place that just a single rain drop, we have blackout. Yeah, it's back again. So possibly this is power surge that I've just spoken about.
Oh, so the lights are back on?
Yes, they are back on.
Oh, that's good. That's good.
Uh,
So I want to just go over several patients' rights that they have here in the United States. Because like I said, there's like 31 of them, and we're close to the end of the show. But I do want to go over a few and some of the standards of conduct and facility rules. So here, from this one corporation is their patient rights. And the first one, just like basic with you, patients are entitled to the following: to be fully informed of their rights, including privacy rights, responsibilities, and all rules governing conduct related to patient care services and financial policies and responsibilities. The right to be accepted for admission without regard to national origin or sponsor, race, age, sex, religion, disability, payer, sexual orientation, marital status, or other factors unrelated to the provision of appropriate medical care. 3, to be treated with 1, respect, dignity, and recognition of my individuality, choices, strengths, abilities, cultural values, religious beliefs, and personal needs to the extent possible during treatment. And 2, sensitivity to my psychological needs and ability to cope with ESRD. And then number 6 stood out. Well, number 5 stood out to me: the right to be free from abuse, neglect, exploitation, coercion, manipulation, sexual abuse, sexual assault, seclusion, or restraint, if not necessary to prevent harm to myself or others, or misappropriation of my personal property by the facility teammates. 6, to receive adequate, safe, sanitary, and efficient dialysis treatment and respectful care by competent personnel in a comfortable environment. And then number 12 is one that stood out too: the right to choose and to change physician and or treatment facility, provided that the new physician and or facility can reasonably accommodate me. I am advised to confirm that the facility under consideration has been certified by Medicare. But what I wanted to ask, Brother Moses, do patients in Kenya have that right to change physicians and facilities and go to another treatment place?
yes, they do have the right. But what happens is that most most patients are really attached to their facilities, current facilities, because even if they are exploited in one way or the other, they still keep up to that facility. But yes, they have the freedom to even request for a transfer letter.
Brother Moses, could you answer Daniela's question? She wants to know, is there an age restriction for dialysis in Kenya?
There is no age restriction for dialysis in Kenya. However, the caregiver can be advised if he goes to the right facility with the right care team. There are some high-end care centers that provides renal services that are of world class. So yes, you can be advised either to not do transplant or not do this because of age limit. So it is applicable sometimes to the only well-to-do class in the society. So there is no age limit.
Okay.
Yeah.
Are there any children at your clinic?
Sorry?
No, I said, are there any kids or children at your clinic?
Yes, we have two. Yes, and I've seen them. The only thing that is quite absurd is that most facilities also admit the juvenile and mixing them with the adult, which is something also might violate the 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 child's right. Yeah.
Let's look at, do your facility have rules
Yes,
and
there
standards
are
of
rules.
conduct?
There are rules, but no one knows about the rules. Only perhaps when you ask or you do a mistake, involuntarily or voluntarily.
Okay. Now I want to read this company's facility rules and potential consequences for failing to, they say failing to comply. And I want you to tell me, do they have these same type of rules in Kenya or at your facility? So there's 13 facility rules here. One, no weapons, uh, alcohol, or illegal drugs of any type are allowed in the dialysis facility. I may not come to the facility intoxicated or under the influence of drugs. Two, no smoking, e-cigarettes, chewing tobacco, or vaporizers are allowed in the facility. Three, no routine oral medications will be provided. I may bring these from home. However, I must tell the staff when I take any medication in the dialysis facility because some medications can cause complication during dialysis. Number four, phones, if available, must be shared among all patients. Please be considerate and pass along the phone if requested after 5 minutes. Five, visitors are allowed in the treatment appointment area only by permission of the nurse in charge. Visitors will be offered use of appropriate personnel protective equipment as deemed necessary. Six, the facility is not responsible for loss or stolen articles. Seven, shoes must be worn at all times in the facility. Eight, young children will not be allowed in the treatment appointment area except under special circumstances as determined by the nurse responsible for clinical care. In addition, children cannot be left in the waiting area without adult supervision. 9, eating is permitted during treatment appointment at the discretion of the facility administrator designee where medically indicated or as per state network requirements. 10, taking video, still photos, or audio recordings of patients and staff members is prohibited in the treatment area. 11, no acts or threats of violence by anyone on company premises is tolerated. 12, no verbal, physical, or visual intimidation or harassment is tolerated. 13, everyone is responsible for immediately reporting acts or threats of violence, intimidation, or harassment. These reports should be given to the nurse responsible for clinic care or other company teammates as appropriate. Potential consequences for failing to comply. I understand I must comply with all stated patient standards of conduct, responsibility, and facility rules. My failure to comply may have serious consequences, including but not limited to physical side effects, loss of privileges, and temporary or permanent dismissal from the facility. If I behave in a way that violates these patient standards of conduct, responsibilities, and facility rules, the administrator, physician, or regional director, as applicable, will discuss the behavior with me. Should I continue to behave in a way that is detrimental to the proper functioning of the facility, the interdisciplinary team, with the guidance of the ESRD network, will follow a progressive behavioral management process up to and including potential involuntary discharge. And then they just go on and say, I agree to abide by the patient's standard of conduct, responsibility, and facility rules at all times while registered as a patient with this facility. Then it says, I hereby acknowledge that I have read and understand the above. I have asked whatever questions I have regarding the patient standards of conduct, responsibility, and facility rules. And if I have further questions, I will ask them. Do y'all have anything like this?
Yes,
King?
yes, yes. We do have. We have it. The Ministry of Health puts it clearly. We have it. Yes.
So one can get involuntary discharge from the unit, just like here in the States?
In that case, I've not seen it. Maybe on that part, it doesn't. It doesn't apply. But then there's a way they can tease you so that you decide by yourself to leave.
Okay, let me ask you
Yes.
this. So let me just say this. So let me give you an example. Here in the States, there was an incident where a gentleman was going to his unit for 10 years. And he was 84 years old, 82, 84. And apparently they were having issues with the machine breaking down. And he said, I feel like, shooting up the place. And they took it as a threat. He said he didn't mean it, but he said it. And they sent him a notice, family, that he had 30 days to find another unit. Now, he's been going here for 10 years. And now he goes to the hospital. Uh-oh, we lost Brother Moses. And now this gentleman goes to the hospital twice a week because of the words he said. Once he comes back, Danielle, I'll ask him. Sometime there is. Especially in other places. I've been told, like in Zambia, I knew someone there, and God rest her soul, she passed away. But she had to get iron off the black market. It's crazy. I'm not sure what happened to Brother Moses. Like he said, they were having blackouts, and maybe this was another one that knocked his internet off. So we went over a lot when it comes to patients' rights, and it kind of mirrors the United States, but over in East Africa, it may not be as detailed and followed through as here in the States, because you have what they call networks. And some of the companies have to follow the network and their guidelines, especially they have guidelines for, okay, here we got Brother Moses back. They got guidelines that they want units to follow when it comes to discharging the patient, because they know that that's a problem. Because if somebody can't find another unit to go to because they blackballed, that means they have to go to the hospital. And the hospitals, they don't set that up for somebody to come 3 times a week, because the hospitals mostly have an acute unit. That's where you're going to go, to the acute unit, and they're going to try to fit you in where they can get you in, because they got to dialyze patients that are inpatient in the hospital. So it takes a lot of coordination, you know. So, Brother Moses, anything you want to say with, so can a patient get blackballed in Kenya? Well, first of all, let me, Daniela had a question. She wanted to know, is there a problem getting supplies to Kenya, dialysis supplies?
Yes, the problem in getting supply, especially
What's going
uh, in government hospitals, where there is that bureaucratic process of doing procurement and supply, so that uh, uh, timely treatment and patient scheduling is up to date. However, um, I mean, this has affected most patients, because you go to a government-owned facility, then you are told, oh, maybe the supplies got finished before financial year. They need that financial year to do this kind of procedure in order to, to procure. Yes, there is a problem of supply.
Okay, thank you for answering that. So Brother Moses, before we end, I wanted to ask you, if a patient gets discharged from a unit, like here in the United States, let's say for instance, if you're in an area and there's a company called Fresenius, and there may be other Fresenius that may be predominant in the same area or territory. And so if that patient gets blackballed or discharged from that Fresenius, they can't go to another Fresenius.
They can't go to another friend.
No, they won't. They
Oh.
won't accept them at another, like a sister unit. No, and they're supposed to find your unit. And the thing is, the receiving unit don't have to take a person because it's a business. They don't have to accept the patient. That's why most of the patients end up going to the hospital, because they want to know, why are you discharging this patient? And a lot of units sometimes spin the narrative, because the patient could be right. I mean, you had different people, and how that situation is documented in the medical records can determine if something happens and not that person's fault, and they get involuntary discharge. They may have a hard time finding another facility. It's unfortunate. They have articles on this. They have
Yes,
articles.
I guess we are also headed to that, because the pioneer of dialysis services, the private sector, are opening up wings and branches. And I guess it will be applicable if one is in a particular company and you have been told that now they no longer accept you. Yes, it might be applicable. However, most units in Kenya are standalone. If not hospital-based, single hospital, then they are standalone facilities. So yes, you can be kicked out of this. The next day, you go to a new one just that has just cropped up. Because remember, the ones that have been established recently are also scouting for a patient, in other words, clients, so that with good incentives, those who take clients there. Yeah.
Mm-hmm. I want to kind of answer this question. Wait a minute, not this one. Right here, Camilla. I've been reading your comments, and only thing I can say, I was listening. Then we'll listen to lungs, and that is 2 is super fast, quick, short breath. This RN is not thorough and doesn't treat us like any nurse we've had in the past 4 years I've been on dialysis. So as I was reading these patients' rights and responsibilities, I don't know what unit or what company you may attend for your treatment, but I would get a copy. If it's the Vita, asking for a copy of the patient's rights and responsibility. If it's for Fresenius, do the same. Because on this one, which is from the Vita, number 6 is you have a right to receive adequate, safe, sanitary, and efficient dialysis treatment and respectful care by competent personnel in a comfortable environment. I suggest, if anyone had any complaints, to go in depth, like Daniela says, and read your information in depth, patient's rights, and see, does any of this apply to you that's happening at the facility. And then when you do make a complaint, you can either do it anonymous, or when you go in to talk to somebody, make sure you have documents, your patient's rights, and which one you feel was violated, and have documentation. on what happened, the day and the date, and possible time. And if you don't see anything getting done, then I would send that same information that you got, maybe make a copy of the page where you feel like you may have got violated, highlighted, type out information, time, and what happened. Don't use your name, and send it to the state agency that inspects the unit. And so now they got a complaint. They got to come and look at and address that complaint. They may even get an inspection. And it's still, if you don't see any changes, then I would quietly transfer from that unit. I wouldn't tell anybody your plans. I wouldn't tell the technician. I wouldn't tell the nurses. I would go find a unit that would accept you and ask them, what do you have to do to initiate the paperwork to transfer? And I would quietly transfer and let your doctor know. You may get another doctor, but I would transfer before making any ruckus. Because if you make ruckus and you do something and they blackball you or kick you out, it's going to be hard getting into another unit. Brother Moses, we're like 23 minutes over our time. Any final thoughts or comments you want to make on patients' rights and responsibilities in East Africa?
Yes. Let me encourage the entire care team, patient, and the support system, including caregivers, that try as much as possible to be aware of these rights and responsibility, so that when you raise your voice accurately and confidently on an issue, so that it becomes an issue based that can be deliberated on. Thank you.
Thank you, Brother Moses. Thank you. Yeah, I believe this was a good show. I hope it reached some individual, folks over in East Africa, ones that may be getting ready to start dialysis or already started and are not really fully informed of their patients' rights. So, and this can apply as well to individual United States, UK, or wherever you're watching. You have to have the same information or similar patients' rights and responsibilities when it comes to your dialysis treatment. So I hope anyone who has watched this will go back, if they didn't read their patients' rights and responsibilities when they first started dialysis. I encourage you to go back, get a copy, and try to look over it, because some of this can be overwhelming reading all this. Have somebody with you that can help decipher what this information says. With that being said, I'd like to thank everyone for tuning in and watching the show. Brother Moses, it's definitely been a pleasure having you here. I know you're experiencing blackouts. So I hope that doesn't last too long. And we'll see you again next Sunday, same time, same place.
Thank you so much. Thank you so much.
All right, brother.
Yeah.
Anything you want to say?
Thank you so much. Let's meet next Sunday, same time, same hour. All are welcome.
All right. Thank you, everyone. We see you next week. Have a great week and stay blessed and encouraged. Peace.